Basic steps to diagnostic coding. As a medical coder and biller, it will be your job to provide accurate codes for the bill or claims that you will send to the insurance companies for payment. When HIPAA was created, it came with standard code sets for procedures and diagnoses. These codes are used on the paper CMS 1500 and electronic claims. It is important to have the correct codes and know how to find them correctly. Otherwise, your claims would get denied and cause a delay in payment. You could also get in trouble and be found guilty of fraud and abuse, which could cause you to lose your ability of being a coder and biller, and you could even go to prison. To avoid these troubles, here are the steps that you should follow. The first step is to identify the main term. So you can identify a main term by using the diagnosis, which is like the disease, any of the signs, any symptoms, conditions, as in like pregnancy, admission, encounters, or complications. Those are the type of words that you want to look for your main term. Second, you locate your main term in the alphabetic index, which is volume 2 of the ICD-10. Once you find it, you're going to review any subterms. So that means if you have abscess of the chest wall, you would look up abscessed and then go to chest wall, and that will lead you to the correct code. My main term is abscess, and then the subterm is chest wall. You will then review any of the subterms under that main term. You will then follow any cross-reference instructions. So sometimes you could find your diagnosis, and then it would say see also, or it would refer you to a different part of the index, and you would just go to that part of the index and look up what it's telling you to look up, and you can also find your diagnosis that way. Once you find what you are looking for in the index, you're going to verify your code in the tabular. The tabular will give you a broader sense. So sometimes it could be something that's happening on the right or the left side, and you want to make sure that you're specifying what side this diagnosis is being presented on. And so you would either choose one that says the right of the chest, or you would choose the left of the chest. The diagnoses do become they're very straightforward, and they're very on point. You will then refer, once you find it in the tabular, you'll refer to any other instructional notations in the tabular. So it could tell you that you can't use that code, or you have to use additional characters. Usually for encounters about a fracture, you would use some extra characters, as in like S, A, or D, which the S is for sequela, the A is for the initial encounter. So the provider would be the provider will have seen this patient for the very first time, and D is for subsequent encounter, which meaning like a follow-up. After that, you would assign your codes to the highest priority. So usually whatever they're coming in for is usually the highest diagnoses, because that's what sent them in here. Sometimes a diagnosis will have like smaller diagnoses, especially it'll have like a reason code. Like for the fracture, for like trauma, you would code the type of trauma that you are that the provider is encountering and is trying to help the patient with, and you would also have to give a reason code with that trauma code. So your trauma code would go first, and then your reason code would go second. After that, you would code the diagnosis until all elements are completely identified. So sometimes like I was saying, your patient will come in for one thing, but it would have been led up by all these other things. So you want to make sure that you're coding to the complete knowledge, so that way when you are turning these claims in, there's nothing that's being hidden from the insurance company, and that you are explaining that you're explaining everything that's happening with this patient for this procedure at this time. And that's basically all. That's basically all for basics to diagnostic coding. Thank you.